Okay, Assalamu alaikum, dear brothers and sisters, and welcome to our Healthy Ramadan Cymru webinars. This is the second year that we have run these webinar series, and we hope that you find it beneficial, inshallah, and that it helps guide you to be safe and healthy this Ramadan for yourself and for those around you. I'm delighted to be joined by a panel who have very kindly given up their time this fine sunny morning to answer your questions and offer you some guidance that is evidence-based on how you can remain safe and healthy. Before we begin, I'm going to ask the panel to introduce themselves. So, Talabani, I'll be your chair for this webinar. I'm going to pass over to Sheikh Mohsen to introduce himself, please.
My name is Mohsen Elbeltagi. I am a Muslim chaplain and interfaith lead in Swansea University.
Thank you, Sheikh. Ayah, would you like to introduce yourself?
Assalamu alaikum, I'm Ayah, and I work as a community pharmacist in Cardiff.
Thank you, Ayah. Mohammed, would you like to introduce yourself, Dr. Mohammed?
Assalamu alaikum, everyone. My name is Mohammed Alhadj Ali. I'm a lecturer in diabetes endocrinology at Cardiff University School of Medicine, and also a scientist in immunology immunotherapy.
Dr. Emaad.
I'm Dr. Alauddin. I'm a GP working in Cardiff-based surgery.
And Dr. Naseem, last but not least, of course.
Assalamu alaikum, everybody. My name is Irfan Naseem. I'm a GP in Cardiff, serving the Grangetown and Butetown areas. Been a GP for 18 years and have been educated in Cardiff.
Wonderful. Thank you all so much for joining us. Just so everybody knows, we are live streaming this on Facebook, and we are also recording it to upload later on our YouTube channels. So if you have any questions, please do ask them. Write them in the chat box. I'll keep an eye on it, and I will do my very best to answer and ask any question that you ask us today. We've also compiled a list of important and broad questions that we can cover today as much as possible in the amount of time that we have. But please bear in mind, this does not replace the advice that you've been given by your doctor. So if you've been given specific advice about a specific health condition, we advise you to follow that advice. We're going to kick off, first of all, by asking Sheikh about Ramadan and why it's so important that we fast in Ramadan and what Ramadan means to all of us.
Bismillah ar-Rahman ar-Rahim, alhamdulillah rabbil alameen, wa salatu wa salam ala Rasulullah sallallahu alayhi wa sallam. The Prophet Muhammad sallallahu alayhi wa sallam has stated in many beautiful hadith the importance of Ramadan, and I'm not going to to recite or to count like many of that, but I'm just going to mention part of this hadith. Rasulullah sallallahu alaihi wasallam says, describe the month of Ramadan as the month of barakah. And he said, sallallahu alaihi wasallam, Atakum shahr Ramadan shahrun azimun barakah, is a great month, and barakah. Barakah in Arabic language means blessing after blessing after blessing. So unlimited blessings. This blessing could be in your health, blessing in your connection with Allah subhanahu wa ta'ala, blessing in connection with your family, blessing in connection with your neighborhood, with your society, is unlimited blessing. Blessing in your rizq, in your wealth, in your salary. So you will blessing in your spirituality and connection with Allah Azza wa Jal, as I mentioned. Allah subhanahu wa ta'ala says, شهر رمضان الذي أنزل فيه القرآن هدى للناس. And it's guidance for people, guide to have a better health condition, guide to have a better connection with everyone. And also it's the month of Rahmah, as Rasulullah sallallahu alaihi wasallam described in the hadith. And Allah sends down Rahmah. Rahmah means mercy for yourself. So you need to be merciful to yourself and merciful to show mercy to others, and show mercy to your family, and show mercy to needy people. So it is really important. Ramadan, fasting in Ramadan is not a routine, is not only being away from food and drink, is being away from every single haram thing, and improving our manners and improving our connection with Allah subhanahu wa ta'ala. So it's a great chance to develop ourselves and to develop our well-being, to develop our connection with Allah Azza wa Jal and our community as well. Jazakumullah.
Jazakallah khair, Sheikh. I'm going to come to you, Dr. Naseem, for our first question, and that is, what are the benefits of fasting on the human body? What's the evidence behind it?
I think if you think about it, your body all your systems, your digestive system, your cardiovascular system has been really working hard throughout the year to process all the food that you've indulged yourself in. And what happens is fasting gives your body time, gives your organs time to relax and to remove the toxins which have probably built up during that time. So it basically just gives your whole body a time to recuperate. There's evidence also that fasting actually improves some of the parameters, that we measure for well-being, like cholesterol levels, like sugar levels in diabetes, and because of that, there's evidence that people, the outcomes of illnesses like people who have heart disease or lung disease or chronic illnesses, some of those outcomes can be improved because your body's getting rid of toxins, your cholesterol's going down, and you've given your body a rest. Also, I mean, if you really think about it, there's also some evidence that mental health improves because all the bad habits you've probably indulged yourself in, like we're going to touch upon this, inshallah, in the rest of the webinar. You're refraining from those, and you're developing strategies, mental strategies of how to deal with them. So there is evidence that mental health, as well as physical health, improve during Ramadan.
Thank you, Dr. Naseem. That brings me on very nice into my next question, which is about the benefits of fasting in Ramadan in general on mental health. I'm going to come to Dr. Emaad to answer that question, please. Dr. Emaad.
Thank you, Bnar. As Dr. Naseem said, Ramadan and fasting does benefit your mental as well as your physical health. And there's two aspects of it, really. One, there's the, sorry, one second. One, you have the biological aspect of it. So there's been a lot of studies looking at how fasting affects your brain and your gut. And they found that your body actually releases a chemical called brain-derived neurotrophic factor. Now, why this is important is it's shown to protect the brain cells, and it can help reduce depression and anxiety. However, aside from the biological side of things, in Ramadan, we find that we have a bigger sense of community. You're spending a lot of time with family, you're eating together, you're spending time with your friends and community in the mosque, for example. So you build up that social connection, that social network, which helps your mental well-being. And as we touched on before as well, Ramadan's a good chance to look at some of the bad behaviors or bad traits that you have, which you can then refrain from during fasting. So whether that be smoking, whether that be some other addictive type behavior, you can use Ramadan to try and refrain from those, which will then in turn help your mental well-being.
Wonderful, thank you. And actually the concept of fasting is no longer limited to Muslims. There are lots of non-Muslims who now fast because the evidence supports that it's beneficial to both our physical and mental health. Thank you for that. So some studies have shown, I'm going to come to you, Dr. Mohammed, to answer this. Some studies have shown that fasting Ramadan actually helps to lower blood cholesterol. What can you tell us about that, and how is it beneficial?
Yeah, as you said, Bnar, fasting now is not only limited to Muslims. So we see many people actually, they do intermittent fasting and aiming from that one to reduce weight and to have a desirable effect on their blood cholesterol and blood lipids in general. So if I talk about like weight loss first, this is like a possible always effect and outcome coming with fasting during the month of Ramadan. However, a team of cardiologists in United Arab Emirates, they found that those who fast the month of Ramadan will have a good impact on their blood lipids and blood cholesterol, reducing the levels of that one by the end of the month. What does that mean? That means this is like a great possibility of reducing the risk of cardiovascular problems, which means reducing the risk of stroke, heart attack, and heart disease in general. Now, if we say that someone fasted well during the month of Ramadan, they maintained good physical activity as well, and they got a reduction in their blood cholesterol by the end of the month, and then continued on the good habits, I would say, after Ramadan, such as like continuing good physical activity and also sticking to a healthy diet, the effect we see by the end of Ramadan will be maintained, and that will remain for a longer period of time. So I would say here that Ramadan is always an opportunity for change. And we advise everyone here to take this one as an opportunity to change lots of habits. When we talk about like our mental health, we need a break, and this break can happen in Ramadan. Spiritual life, physical activity, weight, lipids, cholesterol, all that stuff can be gained during the month of Ramadan. And most important, how we're going to maintain that one beyond the month of Ramadan.
SubhanAllah, isn't it amazing that we've been doing this as Muslims for how many hundreds of years, showing how much benefit it can bring us, both our mental and physical health. Sister Ayah, I'm going to come to you next. Sister Ayah is a superwoman, as always, because she is juggling working and being here with us during this webinar, which is why you'll be often on screen. My next question to you specifically about statins. So statins are cholesterol lowering medications that some patients will be taking. And I'm going to ask you about when patients who are on statins should be taking it if they're fasting or if they're able to fast.
Thank you, Bnar. So usually statins should be taken at night with the evening meal, so sort of around 11 p.m. And that's because they're most effective at that time of day. This is particularly important with short-acting statins. So I can show you like simvastatin, for example. That's a short-acting statin. That's best to take at night. Long-acting statin, so like this one here, a 12-statin, which is best to take anytime throughout the day because it's long-acting, so it's it's important to remember if you do forget to take statin at night, for example, or in the morning, make sure not to double the dose, and there should be at least 12 hours between the doses. So that's quite important, as was mentioned, to avoid eating anything with fruit or fruit juice while taking statins.
So there was a lot of cutting out there, Ayah, so I'm going to just repeat what you said so people don't miss it. There are two different types of statins. There are short-acting and long-acting statins. So people who are taking simvastatin or pravastatin, that's your short-acting statin. The advice is to take that at nighttime after you've broken your fast, so around 11-12 p.m. we normally recommend it. The longer-acting statins, such as atorvastatin, can be taken either at suhoor or iftar because it will act throughout. If you miss a dose, don't double dose. There needs to be 12 hours between each dose that you take. So if you miss a dose, just take your next one as normal. Don't double dose. Does that summarize everything you said? Oh, I think we've lost her actually, but I think that's a good summary.
I think it does, yeah.
Of what she said. Okay. Lovely. Thank you very much for that. So inshallah, Sister Ayah will be able to join us again. If not, we will do our best. So I'm going to come to you next, Sheikh. And the question really here is, what happens if somebody is unwell, either acutely or has a chronic illness, and their doctor has advised them to avoid fasting? What's your advice to them, Sheikh? Thank you.
Jazakallah khair. I think from the Islamic perspective, if we go back to ayah number 184 and 185 in Surah Al-Baqarah, we will find the clear answer of that. People who are ill and unable to fast are exempted from fasting, and they should make up the days later on if they can do so. If they cannot do the days after, so they need, of course, as we know, to pay fidya. But the most important thing here is we need to understand that Islam is not torturing us. Ramadan is not about torturing us, is not punishing us. Ramadan is about to be close to Allah subhanahu wa ta'ala and to achieve taqwa. Achieving taqwa means is mindfulness of Allah. and any harm to our body, if we cause any harm to our body, we are actually not achieving the mindfulness of Allah. Part of the mindfulness of Allah subhanahu wa ta'ala is to look after ourselves, look after our physical body and mental health as well. So fasting could make the person's illness worse or slow down the recovery, and Islam doesn't want that. Islam encourage actually to protect ourselves and to save our body. One of the main 5 essential goals of Islam or Sharia is to protect the person's life, and we are recommended by Allah subhanahu wa ta'ala and the Prophet Muhammad sallallahu alaihi wasallam not to cause any kind of harm to ourselves. So if we do cause our harm to ourselves, actually we are committing sin. So we fast Ramadan to gain the reward of Allah subhanahu wa ta'ala. But if we cause harm to our body intentionally, so we are actually not gaining reward. We are committing sin, wal iyadu billah. So my advice, or the Islamic advice here, is to follow the guidance of your doctor. Always consult your doctor before trying to fast, and you should listen to the advice from your doctor. And because the Sharia focuses on protection of your body and protection of your health, and as I said, if we cause any harm to our health, we have an opportunity to avoid this harm, and we don't take it, we are committing sin. And I'll give an example. For example, akl al-mayta, eating the dead animal, is prohibited in Islam. But in fiqh and Sharia, if the person is dying of hunger and there is no food available except eating the dead animal, and this is the only thing available for him to save his life, he should, by Islam, he should eat part of that, and he should save his life. If he doesn't do, actually he is putting his life at danger, and he is not pleasing Allah subhanahu wa ta'ala. Jazakumullah khair.
Jazakallah khair, Sheikh. And I think it's a really good reminder, isn't it? Because people think that fasting is the only part of Ramadan. There's so much more to it. There are so many other ways that you can worship and be close to Allah in Ramadan. Thank you very much. Dr. Mohammed, I'm going to come to you next. And the question here is, as a diabetologist, what is your advice to people who suffer from diabetes? Should they fast? If they want to fast, what's the advice? Thank you.
So diabetes it's quite a common problem in the Muslim world. We have about 150 million individuals with diabetes across the Muslim world. And if we look at the data actually provided about those who fast the month of Ramadan, we have nearly 80% of that diabetic population. They do fast more than 15 days a month, which is great. So that means the majority of people with diabetes, they're still able to fast, and they can have like a safe fasting between like 15 and 30 days, which means the whole month. Now, fasting for people with diabetes really depends on where they sit on the scoring system for the risk of having complications related and associated with fasting. And these risk factors can be the low blood sugars, namely hypoglycemia, or the high blood sugars, and this is coming sometimes with high ketones in the blood, which we call it diabetic ketoacidosis. For that reason, we have to be very much careful that those who are going to fast the month of Ramadan and they have diabetes in the background, they have to make their fasting as safe as possible. And it has to be like an enjoyable experience for them, where they help themselves to control their blood sugar, to reduce weight, and also to reduce their blood cholesterol as well. So generally speaking, everyone with diabetes should seek advice from their healthcare providers. However, we have like 3 big categories for these people. The first one is the low risk people, and that will include people with type 2 diabetes, which means the diabetes type. This is treated with either like diet and exercise, or sometimes in addition to that one, some tablets, and they don't have any complications related to diabetes in their kidney, eyes, feet. And these people, generally speaking, they have always like a good levels of blood sugars. We go to the moderate one, With the moderate one, we have people with type 2 diabetes. However, they got some problems with their organs, such as like the kidney or the eye, and they have to inject insulin. We move to the third one, which is a high risk or a very high risk, and that will include people with type 1 diabetes, those who are very much dependent on insulin. And insulin is the only treatment for them, and especially if they have complications that will put them at a very high risk category. However, nowadays we review the guidance very carefully, and we talk about like people with type 1 diabetes, those who are very well educated, those who are able to use like the Freestyle Libre, for example, checking their blood sugar regularly, and also taking their insulin as it should be, and managing any symptoms related to that one. So those people can be moving to a moderate risk, and we as healthcare providers should support their fasting. What I would like to say here, if a healthcare provider advises someone having diabetes, saying to them, you should not fast the month of Ramadan based on a risk score calculation, then that means they shouldn't fast, and they should protect themselves and their body as well from any harms or any side effects associated with fasting. And they can always reassure themselves by another discussion with their local imam, saying to them, this is what the healthcare providers advise them to do so. I would like to say here, for the majority of people with diabetes, it is an enjoyable experience for you. It is a good chance to optimize your glycemic control, to lose weight, to reduce the resistance to insulin for those who have a bit overweight, and also to reduce their blood cholesterol and blood lipids. It's an opportunity for change, and I encourage people with diabetes, those who are very much stable in their blood sugars and in their other organs, I would say to them, you should fast, and I encourage you to fast. However, stick to the rules and to the advices which will make your fasting safe and enjoyable experience.
Thank you very much, Dr. Mohammed. And sometimes we also advise our patients, if you're planning to fast in Ramadan, to do a couple of trial fasts that are shorter to see if you can manage it before you actually do a full-on fast. Thank you very much. So the next question is, so I think we're struggling with Sister Ayah struggling to join us. I'm going to come to you, Dr. Emaad, and that is, what part do pharmacists have to play in this? Because pharmacists can give really fantastic advice on medications and general well-being advice. So when should people see their doctors versus their pharmacists about advice like this? Thank you.
So before Ramadan starts, ideally we say about 6 weeks, but it's never too late to see your doctor if you're just on regular medications, just to have a look and see how that may change. So for example, if you're taking medicines which you have to take 3 times a day, so morning, afternoon, evening, you can't do that while you're fasting. So your GP or your pharmacist may say, okay, listen, you can do it this way, or you might have to change the dose slightly and take it at other times. Or they may suggest an alternative if it's something quite important. The same way as Dr. Mohammed said about diabetes as well, the doctors or the pharmacists may consider changing the doses of some of those things depending on what you're eating and drinking. So it is quite important to prepare for Ramadan, make sure you do get the right advice before the month starts. It's very difficult to try and do that when Ramadan is started, because obviously getting the medications, getting everything correct can be quite difficult. So we would say try and see either your pharmacist or your GP about 6 weeks before. But if you haven't done so already, and we know that is quite around the corner, sort of 2 weeks, there's still time. Go and speak to someone, make sure you're on the right medication that makes your fasting safe and doesn't cause you any harm.
Thank you, Dr. Emaad. Dr. Naseem, the next question is, in addition to diabetes, people will have other chronic conditions, either with diabetes or just by themselves. So what other diseases can carry a high risk for people who are fasting? And in particular, somebody has asked in the question, I've got high blood pressure, can I fast, and what's the advice there? Thank you.
Yeah, I just want to elaborate on a point that Dr. Alauddin made. It's really, really important to see your GP or your pharmacist before you embark on fasting, even if you think it's safe. And nowadays, things have changed slightly. You can have that conversation on the telephone. And on the telephone, the GP or can go over your medication, go over your illnesses, and give you a tailored advice. So it's probably easier now to have that type of advice than it was maybe 3 or 4 years ago, because we're well trained in giving that advice. Coming back to the question, you've asked which other illnesses can make fast, which other illnesses prevent you from fasting. I think the bottom line is, if it's chronic illness, like illness which is going on for a long period of time and is not controlled, like say you've got congestive cardiac failure, say you've got chronic kidney disease, say you've got chronic liver disease, and obviously if you've got certain insulin-dependent diabetes, then it's really important that you should really consider not fasting, because as the Sheikh said, that could be very, very detrimental to your well-being and to your overall health. And the whole gist of Ramadan, as the Sheikh has alluded to, is not to harm yourself, and to make it an enjoyable experience, and an experience which will benefit you both physically and spiritually. Like if there's illnesses where you have to take medication on a regular basis, say you've got asthma which is not controlled properly, or you've got chronic lung disease which is not controlled and you need to take your inhalers on a regular basis, I think it's really important you'd really consider the dangers of fasting, and illnesses which actually can get worse because of dehydration, because you're not really drinking that much water throughout the day, and you're having maybe some water during sahur and some at iftar, but you're not drinking throughout the day. So if you've got like kidney disease, and say you're on dialysis, or you've got some serious kidney issues, then it's really important to really consider the dangers of fasting and speak to your GP. Give them a telephone call, give them a ring. They'll ring you back, and you can have that negotiation, you can have that discussion, and come up with a plan which is safe for you, and which will inshallah make the experience productive for everybody, inshallah.
Inshallah. Thank you, Dr. Naseem. I'm going to cover dehydration for a moment here, because I think even if you're not, if you don't have underlying health conditions, if you have really salty food at suhoor, sahri, or iftar, you are going to risk getting dehydrated in the time that you're fasting. So try and reduce your salt intake actually in the weeks leading up to Ramadan, so that because what happens with salt, the more you use it, the more you need to taste it. So as you cut it out, you actually need less of it to have your food taste good. And reduced salt intake means that you're going to be less dehydrated throughout the day, and it will protect your kidneys as well. So that's one thing to bear in mind. I'm going to cover
Can I just go back to that question on hypertension?
Of course, thank you.
I didn't think I had a chance to answer that. I just think the majority of patients with hypertension who are controlled on medication can generally fast quite safely. Having hypertension by itself is not usually a contraindication to fasting, but you've got to be sensible. I think you've got to use common sense, that as Bnar, as Dr. Talabani has said, and you've got to think about your salt intake. You've got to think about your hydration, and you've got to think about your medication. Do they need to be changed, or do you need to monitor your blood pressure throughout the day? I think majority of patients with high blood pressure can fast safely, but go and see your GP, go and see your pharmacist, and have that discussion.
Thank you, Dr. Naseem. We've also had some questions in the chat box. So the first one is, can you give some advice on what a healthy diet would look like in Ramadan? So how to stay healthy, how to follow a healthy diet. I'll open that to the floor to whoever wants to take it.
I'd like to take that question, if that's okay. I think healthy diet in Ramadan, I think majority of people, they think that they have to eat more during Ramadan. But that's not really the case, because you have to look at how many calories you're using and how many calories you're putting inside your body. So generally speaking, the amount of calories you're taking on board should be about the same, maybe less than what you're using during the rest of the year. I think it's important to split your plate up into say quarters, and have a basic concept of what a healthy diet is. Like a quarter of your plate during iftar time, say, should be should be made up of carbohydrate, and carbohydrate is basically sugars which are released slowly within the body, like say some rice, some bread, some pasta, some potatoes. That's carbohydrate. So a quarter of your plate should be made up of carbohydrate, and the next quarter you should think of some protein, some energy, and protein is usually fish, usually chicken, and usually some meat on your plate. So that's made up. That's half your plate now done, and then I think on top of that, vegetables are really, really important. Because you get minerals, you get vitamins from there, and they do help digestion. Yeah, okay. I mean, a lot of people, they want sweet stuff. They want some sweet, but it's really important to be vigilant when you're having sweets during Ramadan, and not to have processed sweet, and not to have too much of it, because the more sweet you have, the more you'd want, because that's the way your body functions. Maybe some fruit would be good during Ramadan, and dates are really, really good. And a sunnah, as the Sheikh will tell us, is the sunnah way of opening your fast. Really important not to have too much fatty food. I mean, we spoke about this at the beginning of the meeting. It's really important you don't really have too much samosa, pakora, and fried curries, fried food like oily curries during Ramadan, because that fills you up quickly, but can tend to harm you in the sense that you need to drink more. You need to it could increase your cholesterol level and ultimately increase your sugar levels, and maybe you could come to harm. So basically, have a plate, split it up, be sensible, have a mixture of fruit and veg, protein, carbohydrate, and moderation with the sweet.
Thank you, Dr. Naseem. Lovely summary. And one person's asked a very important question, actually. So the benefits that we see with fasting, with reduced blood sugar, reduced cholesterol, how long does that actually last if the person fasted Ramadan but then went back to their diet afterwards? Dr. Mohammed, I'm going to come to you for that one, if that's okay.
Yeah, so the study done in United Arab Emirates by cardiologists there showed that if you continue on a healthy diet, which means obtaining and getting like the good habits you started in Ramadan, then that will remain and that will continue as long as you continue on these good habits in a way. However, if you just like after Ramadan, you go back again to like the old habits you used to have when you had the high cholesterol and the high sugars, then things gonna unfortunately reoccur again with high cholesterols and high sugars. I would like to add as well, I mean, about talking about the healthy diet, there are sort of like things we have to follow during the month of Ramadan, and I can touch base on that one later if you want, when we talk more specifically about people with diabetes. It's quite important how to avoid being thirsty during the day, how to avoid taking fast carbs, for example, what sort of like preferred types of food we have to take, and what's sort of like the general advice for people when it comes to diet between the two meals, sahur and iftar.
Thank you, Dr. Mohammed. That would be very helpful, inshallah. Sheikh Mohsen, there's been a question asked in the chat box that I think is a really important question. What if you have a non-Muslim doctor who's advised you to not fast because of your health condition, but your imam is saying to you, you should fast because it's not life-threatening? Those are the words used by the person who asked the question. Thank you.
Yeah, thank you. I think, whether Muslim, whether the doctor is Muslim or non-Muslim, especially here in the UK, and we know the system and everyone is licensed and they go through like professional and so on. I myself as an imam, I consider every medical doctor here who is licensed is a trustworthy doctor. So, and he is the only one is able to advise you on your medical condition. So please follow the advice from the medical doctor. Regarding the conflict message from the imam can advise on the alternative which has been given and granted by Allah subhanahu wa ta'ala. Allah Azza wa Jalla says in the Quran very clearly, if the person is ill, Allah didn't say if the life, if his life is in danger, but He said is ill. Any illness could be considered, and the medical doctor is the only person who will be able to advise you on that, and will give you the correct advice, because everybody is different, and he will be able to check your body, to check your illness. Me as an imam, I have no knowledge of that. I can only advise you on what Allah subhanahu wa ta'ala, and what is the alternative, and when can you do that. Some people, they may be able to fast later and make this up later, and some people they might not be able, and Allah Azza wa Jal has given us other choices like fidya and so on. So please follow the guidance from your medical advice, for your medical doctor on that, because he is the only person is willing to advise you. The other point as well, Islam encourages us to prevent any harm to ourselves. So don't wait to you feel ill. Don't wait till you cause harm to your body. Even if there is a fear of like pregnant women and so on, who may come to this later. If there is a fear may happen, may cause some harm to your health, you should not wait till you harm your body or you have any illness to break your fast.
Sheikh, can I add something to this?
Yes, yes, please.
I think that's the question. Is an excellent question, and Sheikh's made some excellent points. Many years ago, I mean, even going back 5 years ago, say, medical doctors never had much training in dealing with this. There used to be blanket statements like, if you got diabetes, you shouldn't fast. If you got heart disease, you shouldn't fast. And we were doing the same because we weren't trained, or fasting was not fasting. Ramadan and people who were fasting during Ramadan coming to the doctor was not commonplace. But now with the work of these organizations and people like Dr. Mohammed going around the country educating doctors of how to actually deal with patients who want to fast and have illnesses like, say, diabetes, we are much more trained. Even the non-Muslim doctors, they have the training and they have the knowledge which they can impart on patients in an academic way. So it's really important to not disregard the fact if the doctor is Muslim or non-Muslim, because that doctor will be trained, will have the knowledge, and will have the expertise to give you a specific and tailored advice based on your illness and the stage of your illness. So things have progressed, mashallah, and inshallah is going to progress more as more of the Muslim brothers and sisters approach their medical professionals for advice.
Exactly. So yeah, I think you're correct, Dr. Arfan. I mean, the School of Medicines across the countries now, they are more aware of Ramadan and fasting. Just as an example, last couple of months I was working with the School of Medicine here in Swansea and giving them a lot of information about Ramadan and how they are going to teach their students and to improve their knowledge about that. I have worked myself a lot with a lot of medical doctors here in the university to raise awareness of that. So they are actually willing and trained, well trained as well. They understand, most of them, they understand the fasting now. So I think there's no concern at all from seeking the advice. And also you can always, it's a good opportunity for us as Muslims to explain what is fasting and what do we do during fasting, so the medical doctor can have better knowledge about your condition as well.
Yes, thank you, Sheikh. I was just going to say that if your doctor is somehow unaware, which is going to be very unlikely these days, Dr. Naseem said, explain what fasting entails and they'll be able to advise you on your specific condition. And as always, as Sheikh has said, as all of us have said, follow the advice of your doctor. We've had a question about immune disease. So we've got two immunology scientists. Dr. Mohammed is the more senior of the two. The question is, do you have advice for people with immune disease? Now, it's quite a broad question. And again, my advice would be here, speak to your doctor if you have a specialist who looks after this immune disease, because there are so many different types of immune diseases. Explain to them what Ramadan entails and again, take on their advice. Dr. Mohammed, did you want to add anything to that?
That's excellent answer, actually, what you said. in addition to that one, I would probably just say one word, which is like vaccines. So if they have to receive vaccines, they're being advised to take, for example, COVID-19 vaccines, they should receive their vaccinations as it's been scheduled, even if comes during the month of Ramadan. It's quite important. Do not interrupt your vaccination schedule at all.
Thank you, and I would definitely echo that. I'm going to come to Dr. Emaad and Sheikh Mohsen, but first of all, starting with Dr. Emaad, if that's okay, about ladies who are pregnant or breastfeeding and what the advice is about fasting here. Thank you.
Thank you, Bnar. I think we've covered this a little bit previously about what Sheikh was saying about trying to prevent yourself from becoming ill. And that's something that pregnant ladies and women who are breastfeeding might need to consider before Ramadan. Now, the issue with fasting and pregnancy, first of all, is when you're fasting, obviously you're not drinking as much fluid. And if you're not drinking as much fluid, the fluid inside the pregnant woman's uterus, or the fluid that the baby is sitting in, called the amniotic fluid, can reduce in volume. Now, this can cause sort of your baby to have some problems when they're developing, or sort of worst case scenario, it can lead to sort of preterm labor, which means when your baby comes out sooner than it should do. So I think whilst people want to fast, and if you're pregnant, you may think, actually, no, I can still do it. And there's no doubt that some people might. You need to really consider the effect that it can have on your own health and the health of your baby as well. So it's not something to be taken lightly. So do think about it. And if you are going to do it, you really need to pay attention to the fluid aspect of it, as well as the nutritional aspect of it as well. So if you're not eating, your baby's not going to get enough nutrition. That can again lead to sort of impaired growth or development. So these are really important factors to consider in the health of your baby as well as yourself before considering doing fasting. It might be that you do not every fast, but to do intermittent fast, or every other day, or maybe twice a week, something along those lines. So you can still have some fasting, but at the same time not detriment to your child and your own health. Similarly, with breastfeeding women, if you're not drinking enough water, you're not going to be producing enough breast milk. And again, that has implications about how your child feeds and gets their nutrition, and so on and so forth. So yeah, if you do really want to fast and you're very keen on it, again, one of the advices we've always been saying is speak to a medical professional, get some advice either from your midwife or your GP to see how it could be feasible to fast, but something to really consider is perhaps not fasting the entire month, maybe having a few days where you do fast and a few days where you don't.
Yes, I mean, for me, I mean, is the Sharia position is exactly matching with the medical advice. If we go back to the Ayah 184 in Surah Al-Baqarah, Allah Azza wa Jalla says, وَعَلَى الَّذِينَ يُطِيقُونَهُ فِدْيَةٌ طَعَامُ مِسْكِينٍ. So most of the scholars, they talk about the pregnant woman here and the breastfeeding as well. They are exempted. They can like opt out of fasting if the woman fears that it will harm her health or the health of the baby. Missed days of fasting can be made up later. If it's not possible, Allah has given us fidya, can be paid by providing food for someone in need. However, some pregnant Muslim women decide to fast during Ramadan. This is a very personal decision and will depend on your own circumstances, such as the stage of pregnancy. And the Sharia looks at that and how you are feeling, and if you experience any other complication. So the only person will be able to advise is maybe midwife, the GP. So you should discuss your condition with them. And if any potential complication, you may be at risk when you are fasting. Islam, command you to break the fast. Either you can make it up later, or you pay the fidya, and depends on the Islamic opinion you follow, or depends on your condition. So in this regard, I would also encourage everyone to seek advice from your local imam on the best way, whether you make up the days later, or you pay the fidya, or you do both.
Thank you, Sheikh. And from a point of view of breastfeeding, because I have lived experience in this, there's breastfeeding where you breastfeed your child for the first 6 months when they've not weaned and all they're getting is nutrition from breastfeeding. And so you need to make sure that you're able to provide enough for your child. And there's breastfeeding afterwards when your child's able to have meals and baby-led weaning and other fluids. So that's also the thing to bear in mind when you're making that decision. Thank you both very much. The next question is actually a very good one that I'm also interested in. So Sheikh, and this is really a question about healthcare workers or people who have long working hours or very, very demanding, physically demanding jobs. Do you have any advice for those who work long hours, for example, in healthcare? What are the Islamic rulings on this? And for example, what's the advice for night shift working as well, please?
Yeah, I mean, it's a very important question and a practical one, to be honest. From the Islamic point of view, and maybe I answer from Islamic point of view, and if maybe any doctor can advise from medical advice as well. From the Islamic point of view, number one, you need to make your maybe your manager and people you work with aware of your fasting. If you can waive some of the duty, this is good. At least if they can consider this, this is fine. If you are saving someone's life, so saving someone's life is greater than even continue your fasting if you cannot do so. So if you have long hours and you feel that you are not managing, and this will cause a health issue for you, and you have to be at work and for saving someone's life, so you are actually also allowed to break the fast in your circumstances. But again, you need to explain your position and the circumstances if you work to your local imam, and then the local imam can advise you on that. But in general, if this is the only way for you, you cannot take some, I don't know, sometimes you cannot reduce the hours, and you are in like, for example, I give this opinion to some doctor during the COVID, especially first wave. They said, somebody called me and he said, Sheikh, I'm saving people's life, and I'm fasting, and I can't leave the work, and I can't continue fasting as well. I will collapse. He said to me, I'm feeling, I'm fainting and so on. So, and I said, in this case, you need to break the fast, and then you can make up the days later. Because again, back to the Sharia, the essential 5 things in the Sharia: saving your life and saving other people's life. And it is very wise to discuss this with your manager or people you're working with, so you can work out that. If any opportunity to waive, as I said again, to waive some of the duty or to take some breaks to help you for more strength and energy, that's fine. If not, and you have to break the fast, this is completely fine.
Thank you very much, Sheikh. Really appreciate that advice on a personal level as well. Ayah, I'm going to come to you next. So for people who fast and have regular medications, if you can just take us through some of the routes through which we can take medication, either that are different to just oral tablets or alternatives to tablets, what's available. And then I'm also going to come to Sheikh about this as well, please. So just starting with Sister Ayah first.
Yeah, thank you, Bnar. I hope you can hear me. So basically, there's obviously, other than tablet formulations, you can get different types, which I think the Sheikh will go through in terms of what's okay to take while fasting. But some examples include, like, for example, vitamin B12 supplementation. That doesn't have to be taken orally, that can be done via an injection. Also, oral triptans for migraine relief, that can be taken as a nasal preparation. It doesn't have to be taken as a tablet. And then some other options, such as like decongestant tablets or medication for constipation, they can all be switched. So decongestants can also be taken in the form of a nasal spray. And treatments for constipation, there's creams and ointments. And if you have like hemorrhoids, for example, while you're fasting, you can also use creams or ointments and suppositories to help manage those symptoms.
And Sheikh, if I could come to you then ask, do any of those things break fast? So if I was able to take, say, a cream on my skin or eye drops or an injection, for example, does that break your fast?
Not at all. I mean, the majority of the scholar, I mean, they consider, like injections and like inhalers and eye drops, these kind of things, not doesn't break the fast at all. The only two issues here, and the first one is if the injection, for example, for nourishment, this this could break the fast. But if the injection is for a painkiller or maybe antibiotic or something like this, is not doesn't break the fast according to the majority of the scholar. The other thing as well for nasal spray. The only matter is, or the concern, if the liquid reaches your throat. Imam Ibn Uthaymeen rahimahullah said, if reaches the throat and the stomach, this break the fast. The point here, if you have to take it to prevent your illness, so you can take it with care. I mean, I'm talking about the nasal spray. If you can take it with care, if it happens and then the liquid drops to your throat, so you can you break your fast, and then you make the days later. So if you are able to avoid it and maybe adjust it during during iftar or during the suhoor time, this might be another option for you as well. But the majority of other things, like as I said, inhaler, the only thing is oral route. If it goes to throat or the stomach, and if anything considered for nourishment.
Thank you very much, Sheikh. And I'm just going to echo what Dr. Mohammed said earlier about COVID vaccines and vaccines in general. They don't break your fast. You can have them while fasting. In fact, we had one of the imams come along to one of our mosque vaccination centres this time last year during Ramadan, and he had his first dose of the vaccine. Thank you very much. Dr. Mohammed, as a diabetologist, what would be your advice for people who are safe to fast during Ramadan? They've got diabetes. What would you advise them that they can do to keep things as enjoyable and as healthy as possible? Thank you.
Great. So the first thing is have a chat with your GP, with your healthcare provider in hospital, and discuss with them your intention that you're going to fast. That's quite important. If you can do that 4 to 6 weeks prior to Ramadan, that's great. If not, then still okay to call them. And even at the beginning of Ramadan, it's still quite beneficial and useful to have a chat with them. That's number one. Number two, I would say, have a trial of fasting as well prior to Ramadan, and see how fit you are to do the fasting, whether you got any symptoms of the low sugars, hypoglycemia, or any other symptoms of like dehydration, for example, being dry with long hours of fasting. Number three, when you have a chat with your doctor and they stratify your risk score in fasting or fasting the month of Ramadan, then they're going to tell you whether you are like mild, moderate, or severe, or sorry, high or very high risk for fasting. And then for those who've been advised as mild and moderate, they are encouraged to fast with a proper medical advice. When we go to the technical side now of fasting for people with diabetes, I would say it is quite important to have your blood sugar checked regularly during the day. And we advise people with diabetes to check their blood sugar around 6 times around the day. And this is quite important because some people think that checking the blood sugar will invalidate their fasting. And that's not correct at all. And I think Sheikh Mohsen will echo what I say here, and he will support what I say, that it does not invalidate your fasting. It's quite important, and it's a key corner as well of your management to check your blood sugars. If you have low blood sugars during the fasting hours, then you need to break the fasting. And that's quite important. You don't have to endanger your life and the life of other people as well. Also, if you have high blood sugars above 16 or 17, then you need to check the status of your hydration as well. And if you're not feeling well, then you need to break the fasting, take your medication, and get plenty of fluids. Now we move to the other part of the management plan here, which is the fluids and the food. Fluids, we advise people to keep themselves very well hydrated, around 2 liters around the day. And you can add more on this one, Bnar, from your background as a kidney doctor here. It's quite important to prevent agonist dehydration and getting dry kidneys during the month. Also, when you talk about the food, it's quite important, as Dr. Naseem said, that it has to be like a balanced plate around the month. And with the sahur meal in particular, avoid all the fast-acting carbs and go always with the slow-releasing carbs, such as the starch. That's quite important. Avoid the salty food at sahur as well, because with salty food, with very sugary food as well, you're going to feel thirsty all around the day. And this is something will make your fasting more complex, really, and you're not going to enjoy the experience of fasting here. So it's quite important to have always a balanced diet around the day, as I said, and avoid like the fried food and the fatty food, the salty, the quick carbs. That's all the types of food we have to avoid and to bear in mind. The last thing I have to say, and coming back again to the point of like having a chat with your GP or with your pharmacist, you need to think about adjustment to your medications doses. That's quite important. Some medications for people with diabetes, they need adjustment and they need a bit of tweaking to make sure you avoid the low blood sugars and also avoiding what we call it like the high sugars if you drop these medications to a very low dose. So it is quite important that we look at the adjustment to these medications. Some medications should be taken like 3 times a day. Then an adjustment has to happen about like twice a day around iftar and sahur. Also, some medications given in certain doses, the dose should be adjusted as well to keep with the carbs taken during iftar and sahur. As I said, around 80% of people with diabetes around the Muslim world, they fast more than 15 days during the month of Ramadan. We encourage people with diabetes to fast when this is safe for them. We support their personal choice, of course, and we have to help them as well to identify their risk score of fasting. If this is very high or high risk of fasting, then definitely they should exempt themselves from fasting the month of Ramadan.
Thank you, Dr. Mohammed. Just regarding hydration, somebody's asked a very specific question on hyperhidrosis. So hyperhidrosis is excessive sweating. What's the advice? Because they can experience severe headaches, they don't drink water regularly. So hyperhidrosis can come in different degrees of severity. So if your condition means that fasting will make you unwell, really dehydrated, that can have a knock-on effect on your kidney, then the advice is always that's causing you harm. As Sheikh has already said, we're not here. Fasting is not supposed to cause you harm. Follow the advice of your doctor if you're unsure. You can make it up at a different time. But if you wanted to try out some small fasts in the leading up to Ramadan, see if you can manage it and then extend the time when the time comes, take on the advice Dr. Mohammed has just said about low salt intake, really good amounts of fluid when you are doing suhoor and iftar. I hope that covers that. Okay, we're going to come on to asking about COVID vaccines and boosters, if that's okay. So Sheikh, just a bit of advice on vaccination during Ramadan, if I can ask you this.
Yes, I mean, the COVID vaccine doesn't really break the fast at all, and I do encourage people to take it if and if they have to take it during Ramadan, there is no problem at all. So please carry on, and there is no any evidence that this vaccine would break your fast. And there's nothing harm with that at all. If it causes any side effect later, this shouldn't stop you from taking it. If you have to take it in Ramadan, if any side effect happen, then consult your doctor. If it's is hard for you, severe, whatever, you can break your fast. There's there's no problem. But please don't stop from taking the booster.
Thank you, Sheikh. And if I can just add to that, Muslims have the lowest uptake of the booster vaccine in the UK. And please, I want to encourage you to have your booster vaccine if you've not had it yet, or indeed your first 2 doses. The vaccines are our best defense against COVID. They're very, very safe. We're all vaccinated here and boosted. I've had my vaccines and I've had COVID, and I'd happily have my vaccines again over COVID anytime, especially as case rates are really starting to climb again. We want to get together in the mosque and worship and be with friends and family. We need to take steps to protect ourselves against COVID and those around us. So being vaccinated does protect you and those around you, because they do reduce transmission. Anybody who tells you otherwise doesn't understand how vaccines work. There are also other simple measures that we can put in place. Wearing masks, even though they're not required by law, I still wear a mask everywhere I go. That does reduce transmission. It helps protect you and those around you. So we really recommend that you wear it when you go to the mosque and when you're with other people, and also good ventilation. So open windows as much as possible. Alhamdulillah, the weather's getting nicer, so we can open windows and have really, really good ventilation indoors. Anybody else want to add anything to that?
Yeah, I think personally myself, to be honest, I advise everyone to even to have the mask, as you said, always, Dr. Bnar, in the mosque, and also prayer mat if you can. Myself, even since COVID till now, even the rules are eased, I use my own prayer mat all the time. If you can do it, this is really good. Someone said to me, I said, how do I need to carry the prayer mat all the time? This is hassle. I said, it's not hassle like our phone. So if we treat our prayer mat the way we treat the phone, we will never forget the prayer mat. The other thing as well, from a religious perspective, and I really like it so much, more you pray with this prayer mat, the prayer mat will testify for you on the day of resurrection as well. Sayyidina Aboukoura as-Siddiq radiallahu anhu, he had his own clothes for prayer, and it was narrated that when he passed away, he recommended people to bury his clothes with him, so as to testify in front of Allah subhanahu wa ta'ala how many times he prayed with this clothes and so on. So this could be another good deeds you add it to yourself as well.
SubhanAllah, thank you, Sheikh. I didn't know that.
Sheikh, can I add a point to that, Bnar, if you don't mind?
Of course.
Just touching on the COVID vaccination, I think you make an excellent point. In Ramadan, it's about doing good deeds. It's about doing something which will give you spiritual benefit. And I think if you think of having a vaccination as not just protecting yourself, but you're protecting people around you, and you're protecting the wider community. And in itself, it's a good deed. So don't be hesitant of having the vaccination. Think of it in a broader context, and that you're doing a deed which could potentially benefit your community, the people in the mosque, maybe, or the people in your workplace, because you are protected, so you are contributing towards herd immunity. So have that in mind.
And just quickly going to cover safety of the vaccines, I think there's still some concern, but we've given over 10 billion doses worldwide. I've had 3 doses myself. My whole family have had both their vaccines and their booster, alhamdulillah. My daughter is too young, but when she's eligible, she'll be having her vaccines too. Because we've given so many doses, and because we've now had 2 years of vaccination, we've had enough time and enough data to know that these vaccines are very, very safe. Rare serious side effects are incredibly rare, and all of those serious side effects are much, much, much more common in COVID infection itself, and often much more severe. So on balance, even if you're young, fit and healthy, it still makes sense. It's still in benefit. The benefit is still in favor of you having your vaccination, which is why we're all vaccinated here. So I hope that reassures you. Dr. Mohammed, what's your advice for diabetes, patients with diabetes on the COVID vaccine?
That's a very useful question, Bnar, and I think that applies as well for any other chronic conditions or chronic problems, such as like the liver problems or the kidney problems. So any chronic conditions, including diabetes here. So we say to people, in particular, people with diabetes, being diabetic does not mean that there's a higher chance that you're going to contract COVID-19. However, if you contract COVID-19 and you're ill of that one, it's highly likely that your illness with COVID-19 here will be more severe compared to other people. unfortunately. And the outcomes of that one will be poorer compared to other people as well. So in that content, we would advise people with diabetes in particular to take their vaccinations. Those who did not take their vaccinations, it's never been late. Take your vaccinations and start that one, even if that coincides with Ramadan. Those who did not complete the vaccination program, complete that one and get the 2 doses. Those who've been offered a booster and they didn't take it, please do take the booster dose as well. That's quite important. That will provide you with extra levels of the antibodies in your blood, and that will maximize your immune system strength in a way to combat with COVID-19 in case you're exposed to that one. It's quite important, especially during the month of Ramadan. And as I said, the side effects of that one are, I would say, very manageable in a way. As my colleague Bnar said, we're talking about like billions of doses around the world, and we have a couple of years of experience. So it's absolutely safe. We got like whole confidence now in COVID-19 vaccinations that it will prevent agonists, more nasty complications of COVID-19, and also from severe illness as well. Please do take that one and do not hesitate, even if that coincides with Ramadan.
Thank you very much. We've had a question asking if you can have dental treatment while fasting. So for example, injections for numbing. Dr. Emaad, I'm going to ask you that question and then ask Sheikh if that's okay.
I think this is probably more a question for
I think, just as I said it, I thought perhaps I've asked the wrong person. Sheikh, I'm going to come to you, please.
Also ask us about toothpaste as well. Toothpaste while fasting. So I think Sheikh.
Yes. Yeah, I think, I mean, yeah, for numbing, I mean, it shouldn't break the fast, but again, because it's the dental treatment and mouth as well, so you need to have the discussion with your doctor. And they will be able to, the dentist will be able to advise you. The other thing as well, take it with care. Make sure there's nothing goes to your throat and goes. Yeah. This is the only thing, but should not stop you from taking it if you need to with care. Yes, Dr. Franson.
Yeah, I think we should apply, I mean, basic principles to this. If the dental treatment's urgent, you're in excruciating pain, you know, you can't eat, you can't function, you can't work, then I think it's mandatory that you have it and possibly break your fast, because you don't want to come to harm. But if the dental treatment can wait, say you can wait a month, it's a routine type of thing, then it's probably advised that you wait a month and just bear with it. But I think the bottom line is you should, if you really need to have it, you've got to have it, you know. And if you can wait, maybe wait. I think that would be my way of approaching it. I don't know, Sheikh.
Yeah, exactly the same as I said. You know, I mean, if you have to, normally people they don't take such injection, to be honest. And in my experience, I don't know your medical experience, of course, you know, more accurate. That you know, if people are in pain, of course they got to have it. And if you have to break the fast, it's fine. If you can wait, that will be even safer for you. Yeah.
Thank you very much. And what's the advice on brushing your teeth with toothpaste? And I think I know what the answer is here, Sheikh, but I think it's good for you to remind us, please.
I mean, the Prophet Muhammad used to use the siwak and used to do it during his fast. And I know some people mix between the Islamic advice and culture. I know some in some culture people, they don't touch their mouth, they don't put anything, they don't clean their mouth at all during fasting. But this is not really the Islamic advice. Islamic advice, yes, use it, but with care. Make sure you know there's nothing goes to your back throat. Yeah.
Thank you very much, Sheikh. And Sister Ayah, if I can ask you, I mean, we know that COVID vaccine side effects are mild, temporary. Most people don't have side effects. I didn't have any side effects when I had mine, alhamdulillah. But some people can have some flu-like symptoms lasting for a few days. What can people do to manage those side effects after their vaccine, if they're fasting?
Yes. Yeah, so like you said, Bnar, the side effects are quite mild. They can be local, so you can get whether you've had the injection, you can have pain, swelling, bit of redness, but you can also get sort of more side effects throughout the body. So you might feel tired, you might get a headache, you might develop a fever and some chills as well. But like you said, they're mild. It's nothing compared to actually having COVID itself. And that can make you miss up to 10 days of Ramadan, whereas the side effects of the vaccine might just be 1 or 2, and they're quite easily manageable with maybe just some paracetamol, ibuprofen, which you can take, and putting like a wet washcloth on the area of the injection. That will help alleviate any of the swelling that's there. And yeah, it's just basically some sort of management plan like that will help to take care of those mild side effects and ensure that you don't develop any further side effects within 2 days. If you do notice any changes, or if you feel you're concerned about any of the side effects, then just get in touch with your GP or pharmacist. And it's worth mentioning as well, I know some people like to take medication in advance before the vaccine to prevent the side effects. It's not really recommended to do that at all. So it's important just to manage the side effects as and when you get them, and they're quite mild and easy to manage anyway.
Yeah, the majority of people, as I said, don't actually experience any side effects, maybe a sore arm and a bit of achiness. And just coming back to you, Sister Ayah, what would you advise someone who has to have a short course of antibiotics, for example, while fasting during Ramadan?
Yeah, if anyone is prescribed like a short course of antibiotics for acute infections, normally it would be advised for people to break their fast because they are suffering from an illness. They are exempt from fasting. But if, for example, you're prescribed antibiotics that are taken just once or twice a day, then if you wish to, you can continue fasting, and just make sure that you take the dosage, if it's twice a day, within at least 4 to 6 hours apart. So 1 dose at suhoor, 1 dose at iftar time, and that's fine. If your antibiotics have to be taken more than once or twice a day, so 3 or 4 times a day, then it's best to break your fast and make sure that you finish the course of the treatment and that the infection clears, so that you ensure that you are clearing the infection and then you get better sooner. That would be the best advice, I think, if anyone's got any acute illness while fasting.
A really good questions come in. Can you shed more light on the importance of the role of community pharmacists, as patients sometimes don't listen to your advice? Just as a doctor, I want to say that I go to my pharmacist and I ask for advice about medications and general advice, and I do follow that advice, bearing in mind I'm a doctor. So I do hope that reassures anyone who may worry, because I think that's everybody, community pharmacists are professionals. So Ayah, can I just ask you that question as well? If somebody gets advice from a community pharmacist, obviously they should follow it, but what can you say about that?
Sorry, can you repeat that again, the question?
My apologies, that's my croaky voice. If you get advice from your community pharmacist, you should follow it. But can you just give us the sort of things that community pharmacists can actually give advice on, please?
Yeah, sure. So it's quite a range of advice that we can give you. Obviously, we have our sort of own professional judgment. If we need to refer you to see a different healthcare professional, we have that knowledge. We can refer you to see, for example, a doctor or even dentist, optician. But it's a range of sort of questions that we can offer you, not just specific to health conditions. It could be relating to lifestyle changes that you'd like to make. Even like if you're stopping smoking, we can give you advice on that. And I know some pharmacies offer a stop smoking service, so you don't have to go through your doctor if you haven't got the time. So it's a range of things that we can give you advice for, and it's always easier to get to a community pharmacy as well for advice. So that's something that's on the plus side as well.
Wonderful, thank you. And our final question is about managing addictive behavior. So this can be a whole range of things, but as an example, I drink a lot of coffee. So can somebody give us some advice on how we can manage addictive behaviors? The key here, I think, is in preparation for Ramadan rather than in Ramadan. So who would like to take that question, please?
I can start with that one.
I get it. Okay.
Well, I think it's quite a broad topic. I can cover a little bit, then perhaps Dr. Naseem can come in as well. I think Ramadan's a very good way to try and reset a lot of your addictive behaviors. For example, if you're someone who smokes, Ramadan's a really good time to try and stop, and because you're not going to be able to smoke during the daytime, your smoking can be limited to the evening, which automatically cuts it down. But it may be an idea actually to try and cut down and stop altogether. And during Ramadan, for example, with smoking, you can get patches which you put on, which means your cravings are less. So I think use Ramadan as an opportunity to look at some things you are addicted to, whether it's over reliance on caffeine, whether it's overeating, whether it's social media, whether it's smoking, to try and think actually, because during the day I'm going to be not withholding, but controlling those activities, can I extend that to the rest of the day? And then can you then extend that further on past Ramadan? So for the next 12 months, actually, you can try and cut it out altogether or try and bring it under more control so you're less reliant on these type of things. Sorry, I'll pass on to Dr. Naseem as well to have an...
No, I would just echo what you say, Emaad. I think some people don't know they're addicted to say caffeine, and they drink 3 or 4 cups a day, maybe 5 cups a day, and they don't know they're addicted. So it's Ramadan's a good opportunity to actually like reflect on what you are actually addicted to and develop a strategy, a mental strategy of how you can get rid of that addiction or reduce that addiction far beyond Ramadan. So say with coffee, maybe in the month before Ramadan, try to reduce your intake of coffee, maybe 1 or 2 cups a day, maybe less, and see how it goes. You might get a bit of a headache, you might get some aches and pains, you might get withdrawal from it, but you'll know what to expect. So on day 1 of Ramadan, you haven't had your coffee in the morning, and you can't function. You won't be there. You'll know what to expect. So gradually work it out. What's best for you? Have a slow and steady way of actually reducing that addiction. And I would echo that point. When you after Ramadan is not the end, it's the beginning. It's the beginning of starting that new journey of reducing your smoking or not smoking, of not having 5 cups of coffee a day, but having 1 or 2 cups a day, of not checking your social media every 5 minutes, but checking it every evening, say. So it's a beginning of the new journey. Prepare yourself into it, do it, and then come out of it with something which is going to be beneficial to you and beneficial to others around you, and going to be, inshallah, productive for your well-being.
Thank you, Dr. Naseem. I think that brings us to the end of our questions. Thank you so much for everybody who has sent in questions. Thank you to our wonderful panelists for taking up their spare time to answer your questions, and hopefully you found it beneficial and useful, inshallah. Also, a very special thank you to Dr. Emaad, who has behind the scenes made all of this a possibility, all the posters, everything. So really wonderful. Thank you very much, Dr. Emaad. I'm going to just ask Sheikh Mohsen to leave us with some take-home messages from Ramadan, inshallah. Thank you, Sheikh.
Jazakallah khair. I mean, again, Ramadan is a great opportunity for us to be closer to Allah subhanahu wa ta'ala. I mean, it's changing our habit, it changing routine, it changing our behavior. So please, consider this great opportunity. It may not come again, Allah knows best. So please use the time. As we mentioned about, cutting down your social media interaction. This is the time to be closer to Allah subhanahu wa ta'ala. Each moment is a great moment. Each faridah is counted as 70 faridah, 70 fard. Each nafli you do is considered and counted as faridah. So smiling, self-help in the community is considered as a faridah and counted as a faridah in the sight of Allah subhanahu wa ta'ala. One line of the Quran, of the Holy Quran, will be like, pages of the Quran, reciting Quran outside of Ramadan. So please utilize your time to worship Allah subhanahu wa ta'ala. And it's a great opportunity to change our attitude and our behavior. Husnul khuluq, and having good character, is one of the main aim of Ramadan. The Prophet Muhammad says in the hadith, Allah is not in need of your hunger or your thirst if you don't have a good manner. So inshallah, please make your intention, salah, to have good manner, to have good health, and to have good communication with your society and your community, inshallah azza wa jal. The other thing I want to say as well, because this is about health, regarding COVID, if you have any symptoms, if you have any illness, I know everyone is eager to pray Taraweeh. We are all missing Taraweeh and missing the social activities in the masjid. So, but please, if you have any symptoms, don't go to the mosque. Inshallah, your reward will be written for you. But causing any harm or any danger to yourself or to your Muslim brothers and sisters will not benefit you at all. The Prophet Muhammad ﷺ said in many ahadith, the reward is written for you, inshallah azza wa jal, and your intention might be better than your action, and you can still do Taraweeh at home, inshallah. You can, of course, break the fast, inshallah, at home, but please avoid to cause any harm to yourself and your community, because this again is the purpose of Ramadan.
Thank you very much, Sheikh. Jazakallah khair. And also, just adding to that, just a quick reminder of what you can do to be safe to yourself and those around you. Wearing your masks, good ventilation indoors in your house as well to reduce transmission, but also if you go to anybody else's house in the mosque, having your vaccinations as soon as possible, first, second dose or booster, and lateral flow test. If you don't have any symptoms, do lateral flow test before you leave your house and go anywhere, because that will pick up anyone who's got the virus, may not yet know it if they're not showing symptoms yet. And as Sheikh said, if you are showing symptoms, please isolate, please get a test. Do it to protect those and yourself and those around you, because you don't know who you might come into contact with who might be very, very vulnerable to the virus. So inshallah, stay safe. Assalamu alaikum, dear brothers and sisters. May it be Ramadan Kareem for all.
Jazakallah khairan.
Assalamu alaikum.
Assalamu alaikum.